Hello, everybody, and welcome. This is Eunice with Florida Training Academy. We're going to wait about 2 more minutes and we're going to go ahead and get started with our late night CNA certified nursing assistant question and answers. Tonight, we're going to focus on end of life care, and we'll also have another practice questions video that will be posted tomorrow. So go ahead, I'll be monitoring the chats. So let's have some engage in conversations. Let's go ahead and study a little bit so that we can pass our CNA exams. And if you've not heard of me before, my name is Eunice Mathis. I'm a registered nurse and I'm the owner of Florida Training Academy. And so let us go ahead and begin. Question number one. People at the end of life still need mouth care. Your unconscious patient has a dry mouth. What should you do? A, give the person small sips of water. B, brush and rinse their mouth and teeth. C, use swabs for oral care. Or D, ask the nurse to provide the oral care. And what do you think the correct answer is? If you selected C, use swabs for oral care, you're absolutely correct. CNA should provide oral and mouth care to unconscious patients and people at the end of life. You use the oral swabs and sponges for their mouth care. You do not rinse the mouth nor give an unconscious person any water due to the risk of aspiration. So that's why C is the best response for this one. Question number two. You have been taking care of Mr. Jones for a long time, and you know that he has a DNR order. His family is in the room when he stops breathing, and they yell at you to start CPR. What should you do? A, get the nurse immediately, then stay with the patient until instructed by the nurse on what you should do next. B, tell the family he's a DNR and leave the room. C, tell the family he is a DNR and ask them to leave the room. Or D, put on the call light and wait for someone to answer and tell you what to do. What does DNR stand for? If you said do not resuscitate, you're absolutely correct. And this would be one of the patient's end of life wishes. They would have a document that would be signed. And so, A, if someone has a DNR order and they expire, you go get the nurse immediately. And you will stay with the patient until instructed by the nurse on what you should do. In this circumstance, when you get the nurse, this is an emergency situation. However, we will not perform CPR because it would go against the resident's or the patient's wishes. We would have to educate the family on their wishes. And when I say we, I mean you would get the nurse and then the nurse would do so. You would just be there in a supportive role. Question number three. After the body has been viewed by the family and the body is wrapped in A, sack, B, sheet, C, firm mat, or D, shroud. And this one could be a little bit tricky because a shroud is not a term that we commonly use. So number three is D, shroud, which is a large piece of plastic or cotton material used to enclose and wrap a body after death. In most of your hospitals and nursing homes, we may have cadaver or body bags, but you may not see a shroud, a big cloth that we put a patient in. Number four, Mrs. French is unconscious and breathing through her mouth. Which of the following accurately states a consideration in her personal care? A, she will not need frequent mouth care because she does not eat and is breathing through her mouth. And I want to repeat that one. So A, she will not need frequent mouth care because she does not eat and she is breathing through her mouth. B, she should be turned and repositioned once a day to prevent skin breakdown. C, she should have a complete bed bath once a week. Or four, you should talk to her as you do in personal care tax. Which one of these would be the most accurate? I know it's not A, because anytime you have somebody who is a mouth breather, they will need frequent mouth care. And A says they will not need it. And we automatically know that we turn residents more than just once per day. So we know the answer is not B. And so what do you think the answer is? And if you said D, you're absolutely correct. You should talk to her as you do your personal care task. You want to talk to your unconscious patients as you perform the daily care task because hearing is the last sense to go in an unconscious patient, and they still have a right to know, what you're doing. So you do want to communicate with them, although they may not be verbally responding to you. Question number 5. The time following death is called the blank period. A, postmortem, B, postical, C, postoperative, or D, postpartum. Yep, and I knew you knew that one. It is called the postmortem period. So postmortem means after death. Whenever you hear the postictal, that's usually after the period after a seizure where the person is hard to arouse. Of course, postoperative would be after a procedure like a surgery that requires sedation. And then postpartum is after birth. Okay, and anytime you see the prefix post, that means after. This is a long one. All right, number 6, you are taking your client to the bathroom during a home care service. She is elderly with dementia and is at risk to fall due to a hip replacement. The bathroom is down a long hall, and the client has informed you that she has to go quick. When you get to the hallway, she asks that you go get her a clean blouse to change into. What should you do? A, get her to the bathroom, then leave her alone to go get the blouse. B, tell her you will get the blouse when she is safely back in her chair and get her to the bathroom. C, stop where you are, go back with her, and give the blouse so that you'll have it in the bathroom. And there is another option, D, but I'm not seeing it on the screen right now, so I do apologize. But we know safety is always a priority when we're taking care of our patients. So the safest option for this person who has to go to the bathroom really quickly is going to be B. You're going to tell her that you will get the blouse when she is safely back in her chair. And because she had to go to the bathroom, get her there quickly. And then after this one, probably get her a bedside commode or something because we don't want somebody with dementia and who has, probably a weak bladder walking all the way down the hall. Okay. So help her out, be proactive, and let the nurse know that she could benefit from a bedside commode. Number 7, an advance directive goes into effect A, after the person has died, B, when the resident enters the long term care facility, C, when the family agrees it is time, or D, when the resident is no longer able to speak for him or herself. So, an advance directive, what is it? When does it go into effect? All right, so this would be directions. If you're unable to speak on your own behalf because of illness or injury, you're going to put your wishes on paper. Okay, and so this is a legal document that goes into effect when the resident is no longer able to speak for her or himself. And so, again, we just talked about it being a written document, and it allows the resident to make decisions about end of life care. 8, your end of life patient goes into cardiac arrest. This patient has a do not resuscitate order. What should you do? All right, and if you were here for the earlier part of the video, you know that DNR, or do not resuscitate orders, means that we are not going to perform CPR. So what are you going to do? Are you going to do A, report this to the nurse, B, begin CPR, C, do nothing, or D, walk away? And I know that you all are great caregivers, so you're going to report this to the nurse. And you're going to report it to the nurse. Many patients at the end of life choose not to have some treatment, such as CPR, tube feedings, or other things that would prolong life. You would not begin CPR for this patient. So when someone has a DNR order, you want to be looking in the charts. You want to be finding that document before there's an emergency. And if you're in the hospital, usually your nurse will have that order in the front of the chart. Number 9, Mrs. Heller does not want any life-sustaining treatments. What intervention is appropriate? A blood transfusion, B, tube feeding. C, cardiopulmonary it should be resuscitation or CPR, or D, pain medication. Which of these would be life sustaining? And so, if you give someone a blood transfusion, that would prolong life. If you give someone tube feeding, you're giving them nutrients um, through a tube that's connected through their stomach. So that would also sustain life. And of course, if we do CPR, that's a possibility that it could sustain life also. So by process of elimination, the only option that does not sustain life, it's going to be D, pain medication. And so, as a CNA, you don't provide pain medication, but you can let your nurse know when a patient is in pain. So, if they can't verbalize that they're in pain, you're going to be looking for cues such as maybe some grimacing. Maybe they could be guarding, grabbing their arm. Maybe every time you turn them, if they have a heart monitor, the heart rate goes up. Or if you're taking the blood pressure is elevated. So I want you to start thinking of those non-pharmacological ways that a CNA can help with pain. So that could be heat or cold compresses, it could be repositioning, it could be elevation, it could be massage. So you may not give pain medication, but you are wonderful at providing supportive care. Number 10, CNAs assist clients who are dying in order to enable a peaceful death and to maintain self confidence, dignity, and A, self worth, B, morality, C, pleasure, or D, beauty. All right, so we know it's not C and D, but do CNAs help maintain self worth or morality? Yep, it is self-worth. You all did a great job. CNAs assist clients who are dying in order to enable a peaceful death and to maintain self-confidence, dignity, self-worth, self-esteem. These are end-of-life needs. And so tonight's questions, we have 25. They're all geared toward end-of-life care. I have worked in hospice before. It is a lovely place to work. So if you're interested in end-of-life care, just being there, at the greatest time of a family and a resident's needs, I highly encourage you, even if you are a CNA, to go ahead and, reach out, contact the local hospice facility. And hospice isn't just in facility. You can do hospice home care. You can do hospice pretty much anywhere. And you can be with someone. Someone may not be, even though they may have a terminal condition, it's not that they may die tomorrow. Some people have, cancer stage 4, and they're going to be around for, 6 to 9 months. And so you're the one who's providing that quality of life. You're that friend. You're going to be the one who's with them, taking them to the movies, taking them, to the nail salon. So not all hospice patients are so terminal or so ill until they can't get out and move about. So it's not a bad place to work, and I want you to consider it. All right, number 11, the nurse tells you that the resident is a no code. This means A, do not resuscitate, B, begin CPR, C, notify the family if the resident appears to be dying, or D, the patient will not receive any physical care. So if someone's a no code, what does that mean? That's another way of saying do not resuscitate. So you'll hear us say in the facilities, there are no code or there are DNR. Pretty much means we're not going to do anything to sustain life. We will keep them comfortable though. However, we will not perform CPR. Number 12, the total response to the loss experience is referred to as A, grief, B, bereavement, C, mourning, or D, death. The total response, all right, all those feelings and emotions put together, we call that grief. So, grief is the total response to the loss experience. It is manifested with thoughts, feelings, and behaviors associated with the state of overwhelming distress or sorrow. Number 13, you have cleaned your resident up after she has died, but as you wrap her in the shroud, she leaks stool. What do you do? Okay. A, clean her up and put on the shroud. B, clean her up, place a diaper or absorbent pad around her perineum. That's her vaginal, pretty much her diaper area. And then apply the shroud. C, do not reclean her. The mortician does this. Just apply the shroud. Or D, None of the above. All right. So you are responsible for postmortem care. And so that would be part of a CNA or the nursing team's job. We cannot have a person, especially if they have their foul no bowel movement. We have to contain those contaminants. We just don't want to put them in the body bag or the shroud and they're leaking stool. That's going to be a hazard for others. And so you're going to do B, you're going to clean her up. You're going to place an incontinent brief or incontinent pad under her, and then you can apply the shroud. I know it may feel unnatural to clean somebody who is deceased, but you're going to treat them in death the same way you treated them in life, and you're going to provide great care. 14, Mr. Dean is confused and disoriented. What are three possible medical reasons for this? A, low blood sugar, a transient ischemic attack or a TIA, and Alzheimer's dementia. B, alcohol, being in a strange place, being a foreign language speaker. C, Alzheimer's dementia, high blood sugar, and alcohol. Or D, high blood sugar, new surroundings, and a TIA, which again is a transient ischemic attack or a mini stroke. What are three possible reasons for confusion and disorientation? And if you chose A, you are right. Low blood sugar, a TIA, and Alzheimer's dementia. And so whenever someone's sugars get low, they get confused. And when someone's having a stroke or a mini stroke, a transient stroke, they can also have confusion. And of course, Alzheimer's dementia, it deals with cognitive function and confusion. So they're going to have some memory loss. 15, some people have dyspnea at the end of life. Dyspnea is difficulty with A, walking, B, breathing, C, talking, or D, eating. Whenever you see the prefix DYS in front of something, that means difficulty. When you see the other prefix we used was post. When you see post in front of something, that means after the fact. So dyspnea. At the end of life, people have a problem or difficulty with breathing. And so some people have chronic lung conditions such as pneumonia or chronic obstructive pulmonary disease. We call that COPD. But sometimes at the end of life, they have the Cheyne-Stokes, these irregular breaths. That could be a precursor to death. So usually they're going to have difficulty breathing before they expire. Number 16, your resident has died and the family wants to help clean her before the mortician arrives. What should you do? A, tell them this is not allowed and that they can come back when you are done. B, only let them watch as you clean. C, let them dress the body after you clean it. D, it is acceptable. I cannot read that part. I don't know why my screen is not acting correctly. It's not acceptable to allow them to clean the body. I'm assuming that's what it says. And it was actually the opposite. D is it is acceptable to allow them to clean the body. And so that could be like a religious or a cultural preference. And so some of them want to do the final rites. They want to do the last rites. They want to give their family member the final bath. And by law, we have to allow them to do that. So what you're going to do is you're going to be there in a supportive role. You're going to provide the soaps, the washcloths, the gloves, the gowns, and then you're going to be there to provide turning assistance or whatever type of support that family needs. And then once the care is complete, you will be doing the final part of the postmortem care, which would be, of course, putting a tag on the toe and putting them in a body bag. And if you've never done that before, it is fine. You're going to have a nurse and senior CNAs who've been there for a while who can assist you with this process. In the state of Florida, postmortem care is a part of a CNA's role. Question 17. Hospice care can be provided A, at the patient's home, B, at an inpatient hospice facility, C, at long-term care facility, or D, all of the above. So where are hospice patients? Hospice patients are everywhere Before there were hospitals, people were born and they also would die inside of their homes with their families. So, you all, hospice is a philosophy of care, it's not a location. So, hospice care can be provided anywhere. And if you don't recall, I said before, hospice is like palliative or comfort care. Our job is to keep them comfortable. 18. Rigor mortis occurs about blank hours after death. What is rigor mortis? That's when the body gets really stiff. And so we want to try to prepare as much as we can, especially if we're in a hospital or nursing home, the body before the rigor mortis sets in. And so, how many hours would that be? Is it A, 0 to 1, B, 3 to 4, C, 5 to 7, or D, 9 to 12? And rigor mortis sets in, that stiffening sets in about 3 to 4 hours after death. 19, an autopsy is performed A, in all deaths in long term care facilities, B, when it is requested by the CNA, C, if the family or physician requested, D, in all deaths that occur in an acute care hospital. So, an autopsy, they take specimens, they take labs, they want to find the cause of death. And that's not an automatic procedure or a task. That has to be requested by the family or by the physician. And also, if the family requests it, they have to pay for it, which is why we don't always see family members having an autopsy performed because that's an additional cost. So the family or physician can request an autopsy. It must be done under law in certain circumstances, such as a suspicious death, but it's not routinely done for deaths occurring in facilities unless requested. 20, you're caring for a resident as she is dying. She asks you to pray for her. You are of a different faith and uncomfortable with the request. How should you handle this? A, tell her you will sit with her while she prays. B, tell her you will be there for her in silent prayer. C, pray with her in your own tradition. D, all of the above. So, how do you respect religious rites during someone's time of death when they're a different religion from your own? You're going to do all of that. You're going to be there. You're going to hold their hand. You don't have to pray to their God, but you can definitely pray with them. Okay. So, you're going to provide as much support as you can. And if you totally feel uncomfortable, then you will find someone else to go pray with them. 21, your coworker has just come back from maternity leave and she seems very down and depressed. You understand that in some cases, new mothers may not want to leave their newborns to come back to work and may suffer from hormonal originated depression called the baby blues. Having these considerations, which are important to foster team building, is the result of, and again, I do apologize, I cannot see all of the responses, but I have A, generosity, B, suspicion, C, envy, and I think it was D, empathy. Yes, it was. If you chose empathy, you are correct. Empathy is the ability to understand and share the feelings of another person. Having empathy is an important part of team building. I remember what it was like being a new mom trying to return back to work, having the baby blues, having mom guilt. And so you want to be supporting that person as much as possible and encouraging them to stay because otherwise they may decide that it's too much for them. They may need the job, but they also may decide it's just best to stay away from nursing for a while or the care facilities and the 12-hour shifts so that they can focus on the child and be with the child more often. So we need you all to be supportive of new mothers. 22, what type of care focuses on the support and comfort of the dying person and family with the goal of facilitating a peaceful and dignified death? Hi, Juliet. Hi, Renee. A, hospice care, B, hospital care, C, rehabilitation care, or D, restorative care. What focuses on the support and comfort of a dying person? And of course, this whole practice test is about palliative comfort end of life care. So the correct answer is going to be A, hospice care. Hospice care is based on a holistic concept and it focuses on the quality of life and comfort rather than a cure. You're correct, Renee. 23. Many people at the end of life fear being alone. What can you, as the CNA, do to lessen this fear? A, keep the patient in their bed at the nurse's station. B, require the family to stay with the resident 24/7. C, ask a visitor from another room to visit with the patient. D, sit and talk and listen to the patient as much as possible. Person says that they fear being alone. The best response by the CNA is going to be D. I know we're busy. We have 15 patients, 12-hour shifts, but I need you to sit and talk and listen to that patient as much as possible. That's right, Renee. That's the best answer. You can't ask a visitor from a neighboring room to come in because the patient's privacy may be in jeopardy. So we just can't share their information. So you're going to be the one who's responsible because you're the one who's assigned to that resident. 24. Which of the factors impact, I think it should say, which of these impact a person's grief? A, culture and spiritual beliefs. B, age and gender. C, race and age. D, gender and culture. When someone is grieving, we allow them to grieve based upon their cultural and spiritual beliefs. All right. And so people grieve at their own pace. So we're not going to tell someone how to grieve, especially if they've lost a loved one. And sometimes a divorce can feel like the loss of a loved one. And so people may not grieve. You're right. People may not grieve just because of a death alone. They could grieve because of the separation. Okay. 25, we're on our last question, everybody, and we'll be back here tomorrow. I'll have more questions for you, and tomorrow we'll probably do personal care. So we'll try to have about 3 videos each week. Tonight's a late night video. Tomorrow's video will probably come about 8 p.m. I'll find out tomorrow. Depends on how my classes go in the mornings. 25, you are doing postmortem care and your residents' teeth have been out for a long time. We talked about that rigor mortis. You cannot get them in. What do? Do you keep trying? B, do you leave them out and pack them with their belongings? C, do you leave them out and give them to the mortician to put in at the funeral home? Or D, do you leave them out and give them to the family so they can give them to the mortician? You all, the family has enough to deal with. We have to get those teeth to that mortician right away. We have to get those dentures put back in because otherwise it's going to be really difficult. And I don't know if you've ever seen somebody without their dentures, their face looks sunk in. We don't want this person to be unrecognizable, during their funeral. So we have to make sure that the mortician gets these dentures so they can put them back in the mouth. And guess what, you all? You did it. You did it. Yay! And so, again, this is Nurse Eunice with Florida Training Academy. I look forward to seeing you all tomorrow. Again, I think it's going to be about 8 p.m. If I can be of assistance, I'm going to go ahead and put my email address in the chat. And that is admin@fltraining.com. And I wish you all the best. Happy studying to my CNAs and my future nurses. Until next time, have a good night, everybody.